Thank you all for being here tonight, especially thank you to our panelists who've taken the time out of their busy days to join us here tonight. I also want to thank the rest of the Medical Society staff who has taken the time to ensure the coordination, Marissa Steffner, our Managing Director, and our Communications Committee as well for making sure you all knew to be here tonight. So thank you for that. I'm Elizabeth DeVos, and I am the current president of the Duval County Medical Society. I'm an emergency physician at UF Health here in Jacksonville. And the format we'll take tonight will be mostly a question and answer forum. So I'd like to start with some questions that we've prepared or that some of you have sent in to our panelists, but we would like you to interact. If you have questions or other thoughts, please do put them in the chat. If you aren't familiar with using Zoom, if you click on the box that says participants at the bottom of your screen, there's a place there that you can raise hands. If you click the button that says raise your hand, the chat should be at the bottom of your screen as well. Sometimes it's hidden by 3 dots if you have your screen very small, so that may be another place you can find it if you're unable. But if you still don't see how to communicate with Fraser and Marissa to get those questions to us, feel free to raise your hand in person and we'll be happy to call on you that way when the time is correct. So thank you very much. Without further ado, I'd like to introduce our panelists tonight and ask each of them to give us a little bit of their own background. So Dr. Rathore, would you like to introduce yourself?
Oh, I've got one check today.
Good evening. This is Mobeen Rathore. I'm a pediatrician practicing in town. Thank you.
Thank you, Dr. Rathore. And Dr. Joshi?
Sure, I'm Sunil Joshi. I'm an allergist immunologist here in town, and I'm the current president of the DCMS Foundation.
And Dr. Rolle?
I think you said Dr. Rolle. You just call me, I'm sorry. Hey,
Yes.
This is Pauline Rolle. I'm a pediatrician and medical director for the Florida Department of Health and DeVos.
Thank you. And Dr. Caro?
Hi, everybody. I'm Dave Caro. I work in emergency medicine here at UF Jacksonville, and I'm also the disaster medical officer for UF Health Jacksonville.
Great. So as you can see, we have a variety of backgrounds and a variety of different aspects of our healthcare community represented. And we want to make sure you all are able to get the information that you need about the vaccine for yourselves and for your patients. So I think one of the things we'd like to start with, and I think we saw a lot in the questions that were sent to us, is what really is the information that we need to know about the technology of the mRNA vaccine. So I'll pose that to the panelists and we'll take it from there.
Liz, can you repeat the question again?
Can you tell us more about the technology of the mRNA vaccine and what do we need to know about this type of vaccine?
All right, well, let me start by saying that you cannot, this is a protein, the vaccine is a protein made in the lab. All the vaccines that are in the pipeline are very similar. The one that is already approved, the Pfizer vaccine, and now the current one that the FDA voted to approve just maybe less than an hour ago, is also, these are messenger RNA vaccines. This is a protein that is made in the lab, and then it is basically put in a lipid particle, which is basically cholesterol, as a vehicle, and it is injected into the body. Think of it as, the vaccine. Think of the vaccine as the messenger RNA vaccine as as a USB, basically, and it is put in your body. Like a USB is put in the computer, that's your body. It does not impact your hard drive, it does not impact your genetic code, but it runs a certain program which produces antibodies and then it's gone. So that's the basic idea. It sort of takes over the cell's ability, takes over the cell's production of proteins. It produces a antigen, which is like a spike protein. It goes out, the body thinks it's being attacked, produces antibodies to do, and that's how you get the protection. That's a thumbnail sketch of what the vaccine is. Is that what you wanted, Liz?
Absolutely. Thank you, Dr. Rathore. And The other vaccines in the pipeline, I think that, we all know that there are also adenovirus vaccines in the pipeline as well. Can you tell us, or Dr. Joshi perhaps, a little bit more about that technology, and is there anything different that we need to expect from those?
I think you're referring to the Oxford, the vaccine that you're referring to, the Oxford, University of Oxford AstraZeneca vaccine and the J&J vaccine, which both use a chimpanzee and adenovirus as a vector, and then that's what brings the potential response. That's the vehicle, if you will, that is used to enter the body so that the body can now produce the antibodies to the viral vector that's in there. And the chimpanzee adenovirus does not cause human disease. There are some concerns about it, but it does not cause human disease, and it's just a delivery mechanism.
I might just add one thing real quick, Liz, in terms of the spike protein that the Moderna and the Pfizer vaccines are developing the antibodies against. It's that spike protein is what's most important, at least we think is most important with coronavirus, because remember, that's what's binding to the epithelial cells to allow it to infect our human cells. So if we're developing antibodies against the spike protein, it'll be much, much less likely for the virus to attach into human cells. And even if it does, then we have the ability to kill it with the CD8 T cells.
Thanks, Dr. Joshi. So in light of those things, I think you're focusing mostly on the mRNA vaccines, and that makes sense since that's what we have available now, and it looks like that will be likely through the rest of this year, at least, what is available. Can you tell us a little bit more about the kinds of things that you want your patients to know or your colleagues to know as we're deciding whether or not to go ahead and get vaccinated right now? Dr. Joshi?
Sure. So absolutely, I feel like my colleagues in medicine and some of my patients that are at higher risk right now are the ones that absolutely should get vaccinated. There's really very little concern, in my opinion, about this vaccine. The safety and efficacy for both the Moderna and the Pfizer vaccines have been very, very high. You look at 94, 95% efficacy, and we'll see what the effectiveness is once we start giving it to the general population. But unless you have a contraindication, if you have had a severe allergic reaction to an IV medication in the past or to a vaccine in the past, I see very little concern about getting the vaccine at this stage. And remember, the other big thing is if you're allergic to polyethylene glycol, that would be a potential reason not to get the vaccine. But yeah, no, I feel like this is a vaccine that's going to be great for healthcare workers and for everyone, but in particular, those at risk.
Elizabeth, if I might add, from a public health and government standpoint, I think we really need to help people understand this is not mandated. We get a lot of folks coming to us for religious exemption because they're afraid that the government is going to mandate this vaccine. It is not mandated. It is not a requirement for children to return to school. It is none of that. This is totally voluntary. And right now, the risks outweigh the benefits outweigh the risks related to this vaccine from what we know about it. So the Pfizer so far, and as Moderna comes online, the same thing. And so I think it's important as healthcare providers, we help our folks understand that even though we're making a recommendation, we're in no way mandating or trying to trick them into getting the vaccine. And that's what we're hearing from the community, that they're concerned that by us making a recommendation that somehow we're government agents and we're looking to try and give them something else other than a vaccine against COVID. And so I think that's going to be important as we phrase this for our public and we educate them, that we're careful in the wording that we choose, and we're also careful to make sure people know that this is not a mandate.
Are you saying there's a conspiracy theory?
Let me add to what Pauline said. This vaccine, people need to understand, it is a EUA, it is emergency use authorization. It is not considered approved. And so you cannot mandate anything that is not considered fully approved. So there's a legal reason also, even if the government wanted to approve, they cannot approve it, cannot mandate it if they wanted. There's a couple of things that I think the our colleagues need to know is that this vaccine protects you, both vaccines actually, Moderna may be a little bit different, protect you against disease and not infection. And that's why it's extremely important that when people who take this vaccine are still going to need to wear the mask, do social distancing and smart isolation. Though none of that changes. I think that's something that people think, because the vaccines looked at prevention of disease. So only those people who got symptomatic, whether mild, moderate, or severe, there were very few severe actually, they are the ones they identified. They did not look for infection. There will be studies coming down the pike that would look at the infection. The other thing I think, and this is extremely important, we need to manage expectations. And I think when we don't do that, we were going to hurt the whole process. And what I mean by that is there is a reactogenicity to this vaccine. People are going, when they get the vaccines, a good number of them in the first 24 to 48 hours after they get the vaccine are going to have reactogenicity. The scientific word for that is they're going to feel crappy. So if any one of us who has gotten the Shingrix vaccine, remember how crappy you felt the first day? I felt crappy. And and if you compare it to Shingrix vaccine, Shingrix vaccine actually has more reactogenicity than the COVID vaccine, and less COVID and very close to the COVID, the Pfizer vaccine I'm talking about is actually flu vaccine. And so when we're talking to our patients, we have to advise them that expect this so they're not worried about it. Even placebo has reaction. So I think that's very important, because remember, there's some misinformation that one dose of the vaccine protects you. One dose of the vaccine protects you until you get your second dose. So you're going to feel crappy after the first dose. If they know that, then they would be more easy to convince to come for the second dose. And in addition to that, as we are talking about, whether it's your practices or in the hospital, we don't want to immunize everybody the same day. If in your practice, all the docs get it the same day and they all feel crappy next day, you may have to shut down your practice. I actually say get it on a Friday. I usually get my vaccines for Friday. And then the same thing when your families, don't immunize mom and dad and everybody at the same time. Somebody has to cook for the kids. So I think that's what we have to stagger that sort of vaccination. So I think manage expectations, educate them that this is going to happen. It's actually probably a good thing, because in fact, a friend of mine who's a physician is in the trial, and she came after the first dose, she came next day, said, yay, I got the vaccine. I said, why? Because I felt crappy all the weekend. So I think that's one of the ways to manage the expectations.
Absolutely. I hadn't really thought about within a family dividing the date. I'm sure that some of my colleagues have not done that. So that's great advice to think about. Dr. Caro, as we were talking about whether or not this was mandated, how is it going at UF as we're rolling it out with our staff?
Great question. So we have probably about half of the UF Jacksonville staff that has desired to get the vaccine. And so we've got those folks laid out into a plan of getting that over the next week or so. We've already started, and we've had pretty good response so far. I believe Monday was the highest number of folks that we had planned to come through, and we actually had a really good response, over 900, if I remember correctly, that came through that day. So we have a number of folks that are willing to take it. We also have a number of folks that are hanging back and are unsure right now and don't want to take the vaccine. And back to Dr. Rolle's comment of this is not mandatory, so obviously we're making it available on a voluntary basis, but we're encouraging those frontline staff that are daily dealing with the COVID patients or could daily deal with them to actually get the vaccine. So far, so good. We've not had any serious reactions as far as we can tell. And it seems like, as Dr. Rathore said, more muscle aches and myalgias, that kind of jazz, than anything else that we're aware of.
David, I want to add, I have deferred my vaccine until next week. And I think because my moral ethical compass said, I'm not like Liz DeVos and David Caro seeing patients in the ED. I'm sort of, doing infection prevention control, most for Baptist health system and managing it there. So I'm not that at risk. So I decided I'm going to, not this, because you started on Wednesday. So I didn't sign up for this week or next week, but after that, I'm going to sign up because I think Tom Nakagawa is on the call. He and I had a conversation. He said, well, he's scheduled to get it tomorrow. And if he cancels it for some reason, he can get it next week. So I think it's important for us as individuals to see really what our risk is and get those people who absolutely need it in the first 10 days get it. But I'm going to get it too. But I hope both Liz and you got it because you guys are at a very high risk. And that goes back also to our primary care doctors. Right now, there is not availability of the vaccine for those in the general practice. I think the health systems are going to be immunizing their outpatient practices soon, I hope, and hopefully in the next stage, this some way through the Department of Health or CVS or whoever, the state would make this available to Sunil Joshi and the others, and Karen Tauker, if she's see Karen out there, if they are practicing out in the field, you need that vaccine too, because you don't know who you are dealing with if they are. So I think that will come. I know I've gotten that question several times, actually even today, from all over the state. When are we going to get the vaccine? And I think nobody knows. The doses are coming. The other point I think we need to make is, as you said, David, maybe half the people don't want it. That's okay right now, because first of all, we probably don't have the vaccine for everybody anyways. So, and we also probably want to give it to as many people as fast as possible until the next round, if you will.
So, Dr. Rolle, go ahead.
No, I was going to say Dr. Rathore brought up a great point. So I'll just kind of piggyback since he mentioned the health department in there. And I'm hoping that you all will put stuff in the chat, give us feedback, any concerns or issues you have on your mind. That will help with the planning going forward. So as it relates to providers in the community, that I'm asking providers who are associated with a hospital, affiliated with a hospital, and you have the opportunity to get vaccinated through the hospital, please do so. That would be the first thing. Now, if you're not affiliated with a hospital, or you're a dentist or probably no dentists on here tonight, but if you have colleagues who are dentists, pharmacists, and things of that nature, we are looking to be a safety net here. And so right now, there's kind of a question of when it will be available for other medical providers to get the vaccine. Certainly that is going to be based on availability. That's going to be a part of it. Right now, our focus, at least as far as the health department is concerned, we'll be working to get our JFRD vaccinated first, so they will also assist us with vaccinating in the community. So they're at the top of the line in terms of priority for us. And there have been conversations across the state related to other medical providers not affiliated with hospitals. And I've had several folks mention to me that they've heard on various calls that the Surgeon General mentioned he was trying to work with the local hospitals to get those folks vaccinated. I don't have any personal knowledge of that. I haven't been on those calls where that's been said, but we have been asked as the local health department to be prepared to assist with getting other providers in the community vaccinated as the vaccine becomes available. And so I don't know what that's going to look like right now. We're still working on logistics of that, whether it's going to be a pod, whether we'll have you make appointments at our immunization centers. Again, not sure how that's going to look, but Duval County Medical Society has agreed to assist us with gathering that information as it relates to providers in the community. We're working with them on the logistics of that, about how we can prioritize providers even within our own community. But hopefully we'll have some information for you in the next few weeks. Again, we're working through this. This is all new territory for us. So any input you can provide to the process or any questions that you have, we're happy to answer. And certainly feel free to type in the chat as well.
Fraser, there's some chat in the chat box about the consent form. I was going to ask if David or Liz can share the UF Health consent form with you. I'm sure there's not a proprietary thing, and you can maybe put it on the in some way, send it to the DCMS members, and they can change it and use it for their own purpose rather than reinventing the wheel on that. And I think it's a very good consent form with good instructions. So maybe Fraser, you can do that for the members.
I'm working on that right now. I can send that to Fraser right now.
Thanks.
Yeah, we can definitely get that out. And just to put out there, our staff has been trying to maintain a COVID vaccine resource page on our website too, and our emails as well, so we can include all that information on there.
Just take the UF Health logo so David and I don't get into trouble.
Dr. Caro, could you mention any other information that people should be handing out or giving to people that are receiving the vaccine? Is UF linking to CDC resources or other resources at that time for each individual?
That's a great question, Dr. Fuss. Yes, we actually are referring folks to the CDC website, and there's a lot of good information on the CDC website. I find it sometimes difficult to navigate, so I've got a couple things that I know that would be helpful if you go on the CDC website and look under healthcare professionals in particular. It does list a lot of resources for us and what we can provide our patients. There is an app that is being used to track vaccine side effects. We're encouraging folks to use that if they have it. And you know, I think back to one of the things Dr. Rathore said earlier, and I believe also Dr. Joshi echoed this, that the side effect profile here has actually been pretty good. We haven't seen any major reactions as far as I know so far in the Northeast Florida area. So that's actually a good sign, but you can also report side effects on that site that we're also encouraging folks to go to. So yes, we are encouraging them to use CDC resources to help with that in particular.
And it's called the V-Safe. It's V-Safe. If you go Google V-Safe, I'm trying to see if that's it's on the app, on the Apple store. Yeah, it is there. It's called I don't know, but it's a V-Safe program where individuals, without going to their healthcare providers are required by law to report adverse events. But I think the individual recipients can also do it through the V-Safe program of the CDC. And don't forget, every COVID vaccine shot that is given to children or adults is going to go into the registry, immunization registry of the state of Florida, called Florida Shots. So, you know, it would be a very important thing. The other thing, while I have this on my mind before I forget, now that Moderna vaccine is also going to be available, the recommendation is if you get the first dose of Pfizer vaccine, try to get the second dose of the Pfizer vaccine. Same if it's Moderna vaccine, the second dose of Moderna vaccine. Having said that, if inadvertently you get the Pfizer vaccine and then Moderna or vice versa, you don't need the third dose. That's fine. You should keep that in mind, but avoid doing that. There are no data to say there can be interchangeability as we have for many of the other vaccines. Right now, we don't have that data. And in fact, the other vaccines down the road are totally different platforms, so we would have even less information about that. So just keep that in mind. And the Pfizer vaccine is 21, second dose is 21 days after the first dose, plus minus 4 days is what the CDC is allowing.
Dr. Rolle, I have a question that came directly to me, asking whether there's any specific sequence of risk groups that's been published in Duval County for when people will be called up to be vaccinated as it becomes available. And if not, maybe that's something that the Medical Society could help communicate.
There's not anything that we've published regarding specific risk groups other than the different.
Pauline, you're having difficulty hearing you.
I'm sorry. What about now? Can you hear me okay now?
Better.
Okay, great. The only thing that's really been published is related to various phases, phase 1A, 1B, 2, 3, 4. With regards to priority groups, we're taking our direction directly from the state, and they're getting directions from the feds in terms of the various groups. And so there's been a lot of conversation recently around what constitutes a healthcare worker. That's probably the conversation that's most frequently had right now around the state. And so we're trying to get clarification in terms of, as we get our limited pot of vaccines, how we should prioritize folks even within the healthcare worker group. Because of course, there are different types of healthcare workers. And so I'm not sure if I completely answered the question there, but essentially it's based on those phases outlined by the CDC, but we're getting direction from the state with regards to how to use our vaccines.
Thank you. What about people who are breastfeeding? Do we have any information? I know that pregnant patients and lactating patients were excluded from the studies at Pfizer, at least. So does anyone have any specific recommendations for our colleagues who may be lactating or pregnant right now?
The CDC recommends that pregnant women and breastfeeding women should get the vaccine. The Pfizer study and both Moderna and Pfizer studies excluded pregnant women, but there were 23 women in the Pfizer study who got pregnant. And they were, just today I heard there were 6 women in the vaccine group in the Moderna study who got pregnant. So they are following them for outcomes. The American Congress of Obstetrics and Gynecology and the Society of Maternal Fetal Medicine both are recommending that pregnant women do get the vaccine. Remember, we believe that there are about 300,000 healthcare workers who are going to be pregnant. So that's a lot of healthcare workers who need to be protected. We need to remind ourselves that pregnant women have a high risk of morbidity and mortality, both for themselves and outcomes of their pregnancy. So it's important that they consider that now that there is a sort of asterisk to that you should consult and discuss it with your healthcare provider before you get it. And I think that's the same thing for those who have autoimmune diseases or are immunosuppressants. I think so far the people I have spoken to and recommend that they go to their healthcare providers. All the healthcare providers are recommending that because what we know is that the wild type virus infection is much worse for any risk you can have with the vaccine. There's also 2 other pieces of evidence that are important. There is no perinatal transmission of the vaccine, of the coronavirus that we know of, just in case people thought that the vaccine can do anything like that. And secondly, the virus particles are not present in the breast milk. So I think it makes it less likely. And as I already mentioned, it's a USB drive, which doesn't change your hard drive. So it's not going to affect your genetic code.
Just one thing I would add to that too is, again, with pregnancy, a discussion about any medication always becomes a little difficult, in particular a new vaccine. So I think you also do need to keep into consideration the levels of COVID-19 positivity in that location. So for instance, if you're in New York City and you're pregnant and the levels are 25% positive, in that situation, understanding the risks and benefits of getting the virus versus getting the vaccine kind of lifts you more towards getting the vaccine. Whereas if you're living in a rural county here in Northeast Florida and the transmission or the percentage positive rate is very, very low, well then the pregnant woman may make a different decision there. Again, ultimately the decision is up to the mother, but certainly in a community where there is transmission rates that are pretty high, or if there's comorbidities, or if the pregnant woman is a healthcare worker, obviously the benefits significantly outweigh the risks in those situations.
Pauline, I'm saying this in the chat box. Does the state have a process where I know New York has that, where the physicians in the community practice physician can sign up with the state or something, so when the time comes, they would be eligible to be vaccine administrators? I know New York State and New Jersey and some other states are doing that. Do you have any information on that, Pauline?
Yeah, I just saw that question related to becoming a vaccine provider. So community providers should register to become vaccine for children, vaccine for adult providers. And in order to do that, the first step would be to reach out to our immunization section in Tallahassee. And I'll post that number in the chat. And essentially you would go through them. They would provide you with the packet to become enrolled and walk you through that process. And after that, you would fill out a COVID-19 agreement form to become, in particular, a COVID-19 vaccine provider. And again, they could walk you through the logistics of that. But we're encouraging all providers in the community who wish to provide this vaccine to become both, if you see children, a vaccine for children provider, and if you see adults, a vaccine for adults provider. And again, I'll post that phone number in the chat. I don't have it. I can also look for that email address for them to provide to you should you wish to do that.
Fraser, we can perhaps add that to the resource page also.
Absolutely. I think it did go out in one of our emails last week, but we'll make sure that it's available again. Dr. Rolle discussed, giving the vaccine to children. Can someone tell us a little bit about where we stand with getting the vaccine to a point where we can give it for children and what trials might be coming soon?
The Pfizer vaccine is approved for 16 and 17-year-olds. Both Pfizer, Moderna, and Johnson & Johnson have started enrolling children as young as 12 years of age. There is no expectation that the younger children would have any more side effects or the vaccine will be any less efficacious. Of course, we still need the data to show that they are safe and efficacious in the younger age group. The good news is that the children, fortunately, do not get as sick, but they can get very sick. They can be hospitalized, ICU, and intubate and even die. But don't forget that they can also get MIS-C down the road. Why is it extremely important to get children immunized also? Because we need to get them back to school. You know, children are having lots of problems not going back to school. It's mental health issues, obesity, even suicide in adolescents. So, I mean, this is a major issue for us. And as a pediatrician, I think I have to advocate for them. We're all trying, but we at the same time want to make sure that the vaccine is going to be safe, even though there is no expectation that it will not be. We still need the data. And since they have just started enrolling, I'm very hopeful that before the next school year, that which August, September, depending on where you are, that, you know, enough kids would be immunized. You know, if it goes the same way as the vaccine approval for the adults went, and the protocols are already enrolling, I would think March, April, we may have some information that the pharmaceutical companies may submit to FDA for asking for vaccination for children. And hope, pediatricians give vaccines all the time. I think they will be very early adapters. One other point I want to make for our colleagues in private practice, and that the Pfizer vaccine requires a -70 freezer. But the Moderna vaccine is 25 degrees centigrade. So I think it's a much it's something that you can use in the regular refrigerator, that you can store in your regular freezer, regular refrigerator. You don't need that expensive -70 freezer, which you cannot even buy right now. We are trying to order it for our research trials, and they told us a 45-day wait, and every 10 days they say it's 45 days more. I mean, we have a couple of -70 freezers, but they're full. So I think that's something the practices are going to be aware of, that they are going to, because many of the adult providers are not used to giving vaccines, and there are rules that you have to follow for vaccines, including having monitoring for the, for your vaccine. There's 24-hour coverage. So if you need a backup for your refrigerator, and if the temperature falls, there has to be an alarm set up. So talk to your friendly pediatrician. They can tell you what all you need to have the vaccine in your office, because we have been doing it for decades. All the family physicians, many of the family physicians also give, childhood vaccines.
Absolutely. There's a question in the chat about when there will be enough vaccine to immunize the general population over 65. And I think the question really is, maybe more, what can we expect over the next several months, and in how this will roll out in a timeline. And I know it's very much related to the supply that we have, and with today's good news that the Moderna vaccine is moving towards approval for the EUA. Hopefully that will mean there's a lot more supply in the next week or two. But does anybody have any comments for our folks who are asking about, particularly those in the general population over 65?
If it goes as planned, and if we don't bungle it, the expectation is February, March of 2021, the vaccine should be available for individuals more than 65 years of age, definitely those more than 75 years of age. But, unfortunately, Murphy is around, and I expect some issues, hopefully by February, March, those more than 65 years of age would have the availability of the vaccine. And really, my speculation, my hope, my prayers are that next year, this time, we'll have a good Christmas party together or holiday party together.
Absolutely. And Dr. Rolle, there's some more questions about community practices. Do you have any thoughts on that?
As far as when the vaccine will be available to?
Of course.
Yeah. I don't have a timeline at this point. Providers are just being asked to go ahead and get the paperwork in, so they can go ahead and get you processed. And so I don't know what the timeline is for getting that vaccine to them. I would suspect that it's closer to the time when we will be in phase 3 and vaccinating the general population. But again, I don't know for sure.
Dr. Caro, do you have any idea of how many vaccines have been given at UF so far, or what's available in our community right now?
I have a rough estimate. I know that we've given over 1,000. When we initially got our initial shipment, being one of the first 5 hospitals to get the Pfizer vaccine, we got about 20,000 doses, and we've actually divvied that up, and we've between us and Gainesville, we have 4,000 doses that were used here and are earmarked for the folks here at UF Jacksonville. There's 4,000 that went to Gainesville, and then we've got 3,000 going to each of the other hospital systems in the area right now. And those have actually already been made available to those systems and are currently being offered through those systems. That's a little bit tricky because the monitoring of that actually falls back to UF Jacksonville. So our pharmacists are actually working with pharmacists at each of those sites to ensure delivery, but then also oversight of how those are being delivered. And we are responsible for actually putting that information into the register on the backside. So we're being careful about how that gets done, but we're trying to make sure that we're working with our community partners on that to make sure that we make it available widely throughout the different hospital systems. And then hopefully with the addition of the Moderna vaccine coming out and getting targeted to some of the other local area hospitals, that should hopefully ease that load a little bit and make sure that those hospitals get even more access to more vaccine in the very near future.
Thank you. And there's some discussion in the chat. I think the question perhaps previously, Dr. Rolle, perhaps you were speaking to when the vaccine would be available to administer to patients in your office. Will it be sooner for the staff and providers to be vaccinated?
So the staff and the medical providers, earlier, yes, as a part of healthcare workers. As far as the providers who become BFC and BFA providers, I don't have a timeline for that. That's going to be based on availability and production, and how soon they're able to push that out. So once the vaccine is available, the important thing is to go ahead and get set up, because there are some requirements related to BFC and BFA. Some of the providers may desire to be providers, but may not have the proper setup to get started. And so it's important that they go ahead and get that paperwork and understand what is required of them, so that they are prepared when the vaccine is being pushed out to receive the vaccine. I don't have a timeline for when that piece is going to happen in terms of when they can push the button and place the order. We don't have that information currently.
I think the big question, what I'm trying to read between some of these chat questions is like we've talked about, I think you've already mentioned this, Dr. Rolle, is that what about the providers? You know, the providers and their staff being vaccinated. If you are not associated with UF Health, if you're not associated with Baptist Hospital, if you're not associated with St. Vincent's, how do you when can we expect the vaccine to be available to us? I mean, a lot of us have admitting privileges to these hospitals. If I get called tomorrow to go do an aspirin desensitization in Baptist ICU on a COVID patient, I'm going to be required to do it, yet they're not going to provide me with the vaccine. I think that's kind of where there's a lot of concern in the community. That certainly has been the issue that I've been getting a lot of questions on, and I don't have an answer for. I think that's what Dr. Betchkol's question is asking is when can we expect, with some sort of timeline, when we and our staff can actually receive the vaccine?
And so, again, don't have an exact timeline. We're expected to receive, so we're expected to receive the first doses of Moderna vaccine next week. They're saying Tuesday or Wednesday of next week, at the earliest Monday. And so with that, we'll start to vaccinate our fire rescue department, and then we'll go down the line from there. We're expected to receive a total of 16,000 vaccines in this community. However, really only 3,000 were delegated for us to do that work with JFRD. The other 13,000 were delegated to the incident management team to help with vaccinating long-term care facilities. So our, unless that changes, our initial cachet of vaccines is going to be fairly small. 3,000 is not much. And so after that, we expect to receive more doses to be able to vaccinate additional folks in the community, including frontline healthcare workers, and again, healthcare workers. And as I stated earlier, one of the questions was with regards to healthcare workers, how do we prioritize those within any given community? Because there are a number of people in this community that may not be vaccinated with those long-term care facilities. There are folks who are in rehab facilities, in the jail, other congregate settings that are taking care of patients who are not prioritized in terms of those long-term care facilities, and are not prioritized with JFRD. And so we've asked those questions at the state level in terms of when should we expect those deliveries and how soon can we start vaccinating private providers in our community and their staff. And we've been asked to be ready to do that with whatever vaccines we give you, but there's not been a set timeline for that. And so what we don't want to do is start to roll it out and then not be able to complete the process. Because there's going to be a whole lot of folk mad with us if we start vaccinating and we've decided, hey, this clinic down the street, we're going to get started with them, but then there are other providers in the community that did not have that opportunity. And so, like I stated earlier, Duval County Medical Society has offered to work closely with us to help with the prioritization of providers and their offices in this community, and help us get that information to be able to directly communicate with those providers when the opportunity presents itself to vaccinate them. So we'll work with them to push something out when that time comes and to provide details in terms of how we're going to get that work done.
Dr. Rolle, if I could add to that, I can say also from the UF Health side, I know this is a topic that we're constantly going over in our incident command to try and address the issue of how do we get the community practitioners that are seeing patients and are at risk to get them vaccinated as well. And right now, I know that the main issue comes back to exactly where Dr. Rolle was going, is we don't have the information on when exactly we'll have more doses that are coming available. We've got a very clear list of folks that we want to try and vaccinate. First and foremost, trying to get to ICU staff, floor staff, the folks that are taking care of patients in the hospital that we're already kind of at red light at. And we want to include as much as possible the folks that are in the community. We're just trying to make sure that we have the doses available to do that. And that's where we're running up against the information that's being provided to us. And we are also looking at working with DCMS to try and make sure that once we know and we have it available, that we can make DCMS immediately aware so that we can get more folks in. So as soon as we get that information, we'll be working with the Department of Health and with DCMS to try and make that available. And I think that's where you'll find the delay is we're at the mercy of the information coming to us. And once we get it, we're gonna turn it around right away.
Sunil, you said something that you have privileges at Baptist. I've been very intricately involved with the discussions there. You should check with the medical staff office. There is a whole ethical model we have created. Who needs to get it first? And independent practitioners who see patients at Baptist are a part of that. Unfortunately, that would not include your office staff. But if you see patients, and I would suspect that's the same thing at the other hospitals in town, because this is starting with the hospitals, and so if you have to come into the ICU to do something, we want to make sure that your chance of being infected are not very high. So I think you should check with the medical staff office. I'm almost certain it's not going to be right away, and I think I saw question from Dr. Ashraf Afan on the chat box that why can't we be a part of a quota from the hospitals? I don't think so. That's going to happen right now. Also, don't forget, the people who got vaccinated today, in 3 weeks, they need the second dose. So when they get the second shipment in 3 weeks, you have to give preference to them who've already gotten vaccinated. It makes no sense to partially immunize a large number of people. So, but I would encourage all of you to check with the medical staff offices of the hospitals where you have privileges to see what, if any, plans they have.
Yeah, I think that is also part of the challenge. Baptist did send us an email with, when you might be, in line to get the vaccine. And it's phase 1, phase 2, phase 3, but it's like Dr. Rolle was saying, I think, everyone is kind of at the mercy of the supply. And, right now that's the biggest issue is when will the supply be there? And I think that's where there's some frustration with private practice doctors because not always kept in the loop with that kind of thing. And so, but that, the supply seems to be the issue. It's nobody's fault. And, we all understand that. But I think that's also part of what we have to do as a medical society is even educating our members about that there is going to be a time when this will be available. We don't know when that is, but we are working on it. We need to make sure our members also understand that too.
And also needs to be said that Scott has said several times and that he and the state are very aware of this need and they are very cognizant because that's part Scott.
Dr. Rifke is the state surgeon general, you mean?
Yeah, Scott Rifke, the Surgeon General, and Scott has said that many times. So I think it's not something that is lost to the planners. Again, it's a broken record. It's how much vaccine we can get, and you already heard that Pfizer had to slow down the production, unfortunately. So these things are, as I said, Murphy is going to be around for a while.
So I can commit to all of you that we will be working on this, and Fraser and Marissa as well have already come to me asking how we can work on coordinating with the health department. So we do assure you that we will be working towards getting our members vaccinated as soon as we possibly can, and we'll work to coordinate some of that prioritization information. So watch for an email probably at the beginning of next week.
Liz, there's a
question
in the chat box about people who are previously infected, and
right.
I think there's also a lot of misinformation about that we need to really address that. The CDC says let me stop there. If you are acutely infected, you should not get immunized with corona. If you're acutely infected with coronavirus, don't get the vaccine. That's not any different than if you're acutely infected with pertussis or influenza, don't get the vaccine. So that's pretty standard. And we all know that if you get coronavirus infection, you have antibodies and your chance of getting reinfection in the next 90 days is very little. Even it's rare even after that, but definitely 90 days. That's what the data suggests. There's some recent studies about 5 to 6 months, but 90 days is what we know. So you can potentially defer the vaccine if you want to. That doesn't mean that you can't get it after your acute infection is over. You don't have to defer it for 90 days. There's this misunderstanding. There's something called antibody-dependent enhancement, which causes enhancement-related disease, which has been seen in some other, in the 60s and 70s, they had an RSV vaccine that caused that, and in dengue fever that has caused, but there are several serotypes of dengue. So it's a little more complicated than that, but there's no evidence of that in coronavirus. So if you have had a previous infection, you should still get vaccinated, because we don't know how long your protection is going to be. There also, somebody had put in a question earlier on, how long is the protection for? What we know is that remember initially when the information came out, we knew that the protection was for 3 months. Now we know it's for 4 months. So as time goes by, we'll know how long the protection is going to be, because those participants are going to be followed. The individuals who are immunized are going to be followed. And don't forget, this is nothing new. It's the urgency issue. It's less that everybody's paying attention to it. If you remember hepatitis B vaccine, why do we think we know that you don't need a booster? Because that cohort has now been followed almost for 30, 35 years. HPV vaccine, there's a cohort of women in Scandinavia that has now been followed for almost 20 years. So as we gather the information, we'll know. The more important question is, are we going to need the vaccine every year? The answer is we don't know. We hope that we don't need it every year, but we may. And so I think the viruses mutate all the time. That's not a surprise. If we are familiar with influenza vaccine, right? There's a shift every year. I mean, there's a drift every year, which means a little bit of change. That's why you use a new vaccine. And every 10 to 30, 40 years, there's a drift. That's why you have a pandemic with influenza. But I think with this virus, we don't know that. Now, this virus has already mutated, but the mutation is not significant enough, and the antibodies to spike protein are still protective. So a lot of these things, we don't know the answer. I think it's very important to be sure we say what we know and we say what we don't know, so we keep the confidence of the citizenship and we are transparent about it. Okay, the more gray hair I get, the more older I get, more comfortable I am by saying I don't know the answer to that. And I learned that from Dr. Schiebler. It's okay to say you don't know.
I have one more question that came to me asking about some of the other top vaccines. Can you give us any information at all about what we think is on the horizon for some of the other vaccines that may be coming besides the mRNA?
Well, the two vaccines we talked about, remember earlier on, the AstraZeneca vaccine and the J&J vaccine, they are both with the adenovirus vector. And then there's the Sanofi vaccine, which has an adjuvant in that. Also, I think the J&J vaccine is a single dose. That's going to be very important. So those, and then of course, the vaccine that's probably going to be used most in the world, believe it or not, is not the Pfizer vaccine, it's not the Moderna vaccine, and probably not even the AstraZeneca vaccine, although AstraZeneca has given a permission and authority for local pharmaceutical companies in many countries in the world, South Africa, India, Brazil, to make their own vaccine. They've released, they've said this is not patented, you can do it. But it's the Sinopharm vaccine. Sinopharm is the Chinese vaccine. Don't forget there is Sputnik 5, which is the Russian vaccine, and Sinopharm, which is the Chinese vaccine. Now, I don't know if they're any good or not, but I'm not saying they're not. I just don't know because the data is not available. They're not transparent about it. But what I can tell you is that many countries in the world who have already signed up with Sinopharm to get those vaccines to their population. And they have looked at the studies, and that's probably going to the one vaccine that's going to be available more. So not in the US, of course, but other parts. So expect next to be AstraZeneca, and then on its heels is going to be the Novavax vaccine, the J&J vaccine, the Sanofi vaccine, and there are many other vaccines in the pipeline. We need multiple vaccines. There could be production issues. There could be, there are so many issues. We cannot be, if those of us who are old enough to remember what happened in the 90s when there was only one vaccine manufacturer in the United States and there were lots of vaccine shortages. We can't afford that with coronavirus.
Absolutely, thank you. We're running low on time, but the last question that is currently in the chat is about becoming asymptomatic carriers if you've been vaccinated. Yet still being infectious to those around you.
I think I addressed that earlier, that vaccines, the two current vaccines, we know they protect you against disease. We don't know if they protect you against infection. I'm not saying they don't, we just don't have that data. Now, Moderna has some data on that may protect against infection. So that is why we have to continue the face masks, the social distancing, the smart isolation. We have to continue to do that. Otherwise, it's going to be a challenge.
Thank you. We have a couple of minutes left, and I'd love to open up to any other questions that may be burning in the audience. I know there's a lot of far-fetched and maybe some slightly more plausible concerns in social media going around, and that's something that I think we've tried to address, the ones that we think are truly concerns, but I appreciate everyone's time and thoughts on those as well. Dr. Rolle, I just had one more question about how incident command is being used in the city. Could you comment on that?
Yes, and so throughout this pandemic, we've had an incident command structure in place. We have stood up a separate incident command structure for the vaccine events. We're working very closely with the Emergency Operations Center and the City of Jacksonville to work together to do pods in the community as we try to get folks vaccinated. And so, yes, there's an incident command structure in place. We have an incident commander here, Richard Ward, who is over our emergency preparedness division. He's working very closely with Commander Captain Woodard and others at the Emergency Operations Center. And so, yes, we have stood up incident command for this event.
Thank you.
And Pauline, the vaccine is going to be free, right?
Yes, it is.
And there is going to be the providers, the physicians will have administration fee for that they can charge. I know CMS has come up with that. And do you have any information on that?
Yes, they can charge an administration fee. There has been so providers of the vaccine can certainly do that. You know, administration fees are usually somewhere between $5 and $10. I don't know, know the details of that, but they can certainly charge an administration fee. Yes.
There's a code for that and everything.
Yes, yes, there are codes related to that.
Thank you. Dr. Joshi, were you about to say something? Oh, I thought you were about to say something else. I didn't want to cut you off. Did you have a final thought before we finish up?
No, I mean, this was a great roundtable. Really enjoyed talking to her. I kind of feel bad for Dr. Rolle because everyone's putting the heat on her, and it's not her fault. And actually, it's nobody's fault. It's just this is what it is, and we have to try to figure out a way to protect our healthcare workers so that we can protect our patients. And I do want to applaud Dr. Rolle and the DeVos Department of Health. You guys are doing a great job with so many things. You have to worry about the schools, you have to worry about flu vaccines, you have to worry about this whole COVID vaccine thing. And so thank you for everything you're doing for us too.
She's superwoman.
She is, she really is. We gotta get rid of that interim label and make sure she's here for a long time.
I have a super team, but there were some really great questions asked tonight, absolutely legitimate questions. All of these are very much concerns for all of us across the state. There are a lot of questions and not a whole lot of answers. And again, a lot of it is because this is new. We don't really know what the production is going to be like at the end of the day in terms of this. And so we're at the mercy of the manufacturers really at this point for the most part. And they are doing their best to get these vaccines out to us as quick as possible, and we will be good stewards over them. And so thank you all for asking the questions tonight. I don't take any offense to any of this. Hey, this is what happens in public health. You take the good and you take the bad. But through this, we will all get through it. And thank you all. And again, we'll do our best to be transparent throughout this process and communicate with you as best as we can through DeVos County Medical Society as well as through other venues.
I really want to thank you, Dr. Rolle, and thank all of our panelists for your time tonight and your insight. I want to thank everyone who joined us tonight. Thank you for the work that you're doing to keep our community healthy. Thank you for your concern and attention. And it's our commitment to you from the DCMS that we will be working with the health department and the hospitals that are getting the vaccines to assure that we are helping to prioritize and making sure that we're able to help assure that all of our members are getting vaccinated as soon as it is absolutely possible. So thank you again for everyone's time tonight. Fraser, do you have any final housekeeping details?
No, not at all. We were recording this, so if you wanted to recommend or share this with any of your colleagues, that would be fantastic. And just please utilize us as a resource, and we'll continue to try and share the word as we get it from all of our community partners.
Thank you. I'll just put in one final plug. There is still some PPE available. So if there's anyone that's having difficulty accessing PPE or needing to order for your practices in amounts that are untenable, that's really something that Fraser and our staff have really helped us to do in the last several months. And so we're thankful for that. And there is still some available if anyone needs to take advantage of that.
Yeah, terrific. And don't forget your flu vaccination with all this discussion about COVID vaccination, and Dr. Joshi's project on Flu Vax Jacks continues onward, and let's keep reminding patients that that's important as well.
And don't forget, if your patients don't have insurance, I'm sure you guys know this, but you can go to fluvaxjacks.com and they can put in their address and their zip code, and we'll be able to direct them to a pharmacy that will provide them a free flu vaccine. And we'll send them a voucher and everything. It's amazing. It's been a great project. So thank you, Fraser. You got me excited there. I shouldn't have said that. But yeah, we're up to 44% our adult population vaccinated in Duval County. We usually only have 36%. I mean, so people here are getting the message, and we're very close to our goal. So keep it up, guys. Thanks.
Thank you. Well, thank you everyone for joining us tonight. Please do share this information with your colleagues, and we'll be here for your questions throughout the season. Thank you.